India's government has actually done, I think, quite well compared to other countries when it comes to marginalized groups. That doesn't mean that everything's perfect, but it does mean that the government has developed a national strategy that prioritizes high-risk vulnerable groups. Civil society is an absolutely essential partner. Civil society organizations at every level, whether they're national, state, or local, are essential partners in doing that work, defining policy, designing programs, and implementing those programs to the beneficiary populations who need them.
भैया जी ये मेरा बर्तन लगी है।
अरे कहाँ लगी है?
अरे सब्जा कीजिए लगी है।
हाँ समझ गए। आप ना हमारे साथ किसी पास वाले खेत में चलिए।
खेत में? अरे खेत में जाएंगे वहाँ कोई देखेगा तो? अरे नहीं नहीं खेत में नहीं जाएंगे।
आपको चले जाना है।
हाँ।
I believe that the Indian health system has not paid adequate attention to the health of young people, particularly adolescents. But again, it's unrealistic to expect that the young people will come on their own to healthcare facilities. That's not their natural destination. So we ought to develop much more community-centered adolescent healthcare facilities or health promotion facilities as well, which operate in schools, in communities, engage youth groups. So unless we change the framework of our approach to young people's health, we will still be achieving very incomplete coverage and very poor results.
हमारे सेंटर पे 30 लड़कियाँ आती हैं। जो प्रशिक्षण हमें यहाँ से मिला है कि भाई लड़के और लड़की जब युवा अवस्था में पहुँचते हैं तो उनको क्या क्या उनके चेंजिंग होते हैं, शारीरिक मानसिक चेंजिंग होते हैं, उनके बारे में हमें यहाँ से जानकारी मिली अच्छे से। साफ़ सफाई के विषय में, सेक्स के विषय में, उनको गलत राह पे चलने से अच्छी तरह से यौन स्वास्थ्य के बारे में जानकारी देते हैं उनको, ताकि वो किसी गलत राह पे ना जाए।
This program has been a boon for these young people in the community, I would say. And through Young Health Program, we have been able to, educate and convince the doctor there that, he should have a separate time slot wherein he only attends young people.
For issues like HIV and AIDS, populations that are socially marginalized or criminalized continue to face significant challenges in accessing care.
People who were denied to even access the basic HIV/AIDS related services were brought back to government program by Pehchan. They were provided services like additional counseling, partner counseling, feminization related aspects. These are the kind of need-based services, community-specific need-based services which Pehchan has managed to provide.
End of 2013 onwards, there will be no more bilateral development on health. So we are obviously going to address the issue differently, and this is because India graduated to a middle-income country, and decisions from the European Commission to stop bilateral funding here and to shift mainly some of the resources to countries like in Africa. We are going to continue to fund civil society, and health will be one of the sectors where we will be continuing to look at. Whether you look at it from any angle, even from growth, economic growth, employment angle, I mean, health will be an issue that is important. If you drop health and education, well, you will not have healthy people, you will not have educated people, so you will have a skilled employees which will not have sufficient skills or not in good health enough, so it's not in the benefit of the country anyway.
Donors are not any longer to be seen as people who bring in scarce resources. Donors are to be seen, and they have to play this role consciously. They have to pull back and allow for the development or the seeding of ideas and processes that will allow for the local community, the local leadership to take ownership of the change that needs to happen in the country.